What if the key to understanding your fibromyalgia and whether your treatment is actually working isn't just tracking your pain? For both patients and doctors, it feels like a crucial piece of the puzzle is missing. You might track your pain on a scale of 1 to 10, but what about the crushing fatigue? The brain fog that makes it impossible to concentrate, and how do you measure if a new therapy is improving your ability to simply get through the day? For clinicians, how do you quantify progress when your patient just says they feel a little better? The frustration is real and it's shared. Patients feel unheard, their most debilitating symptoms minimized. Clinicians lack the clear data they need to confidently adjust treatment. We're going to look at two simple but powerful tools that go beyond just asking, where does it hurt, and could change the way this condition is managed. These tools, developed by the American College of Rheumatology, create a common language for the invisible parts of fibromyalgia, turning subjective feelings into concrete data that can guide the path to a better quality of life. For millions living with fibromyalgia, the journey often starts with a long, frustrating search for answers. You experience a whole collection of symptoms, a deep, widespread ache that moves around your body, a level of exhaustion that sleep doesn't touch, and a cognitive haze, often called fibrofog, that can make simple tasks feel monumental. You might also struggle with headaches, irritable bowel syndrome, and heightened sensitivity to touch, light, and sound. Does this sound familiar? You go to a doctor's appointment, ready to explain this complex web of symptoms. You try to describe the feeling of waking up just as tired as when you went to bed. You want to explain the trouble you have with memory and focus, the way words can sometimes feel just out of reach. You want them to understand that the pain is only one part of a larger, life-altering burden. But so often the conversation narrows. The main question becomes, on a scale of 1 to 10, how is your pain level today? Single question, well-intentioned, is a massive oversimplification of the fibromyalgia experience. It reduces a multi-system illness to a single number. It's like trying to understand a complex symphony by only listening to the violins. You miss the percussion of fatigue, the notes of poor sleep, and the unsettling melody of cognitive issues. This narrow focus can leave you, the patient, feeling invalidated. It can reinforce the devastating feeling that maybe it really is all in your head, a sentiment that is completely untrue, yet one that so many patients have been made to feel. For clinicians, this limited approach is just as frustrating. You help your patients, but fibromyalgia symptoms are famously variable, changing from day to day. A patient might report their pain is 7 one week and a 6 the next. Is that a meaningful improvement? Is the current treatment plan working? Without a way to measure the full scope of the illness, treatment becomes a cycle of trial and error. You might prescribe a medication that targets pain, but it could make fatigue worse, resulting in no real improvements to the patient's quality of life. The core of the problem is a lack of shared language. Patients struggle to translate their experience into words, and clinicians struggle to translate these words into measurable data. This disconnect leads to incomplete treatment strategies. The result is stagnation and frustration for everyone involved. This is precisely why moving beyond the simple pain scale isn't just a good idea, it's essential. The good news is the medical community has recognized these limits. For decades, diagnosing fibromyalgia relied on the 1990 American College of Rheumatology criteria, which was all about a physical tender point exam. A doctor would apply pressure to 18 specific points on the body to see how many were painful. While groundbreaking at the time, this method had big problems. The exam's accuracy could vary from one doctor to another, and it completely ignored non-pain symptoms like fatigue, unrefreshed sleep, and fibrofog. Realizing this, in 2010, the ACR introduced revised diagnostic criteria that marked a major shift in how we assess fibromyalgia. They moved away from the tender point exam and toward a patient-centered approach that captures the full spectrum of the illness. This new framework was then refined in 2011 and 2016, making it even more robust and useful. This gave us two powerful, yet often overlooked tools. These aren't complicated or expensive medical tests. They are simple questionnaires that can be completed in minutes, but they provide a comprehensive and measurable snapshot of the fibromyalgia experience. Because symptoms can vary so much day to day, both tools ask your average experience over the last 7 days. First, we'll look at the fibromyalgia survey criteria, which is used to diagnose and track symptom severity. It's made of the widespread pain index and the symptom severity score. Together, they answer the question, what are your symptoms, where do they occur, and how severe are they? The second we'll look at is the Revised Fibromyalgia Impact Questionnaire, known as the FIQR. It measures the real-world consequences of your symptoms. It answers the question, how much is fibromyalgia impacting your ability to function and live your life? These two tools are the overlooked keys we've been talking about. They create the common language that's been missing. They allow patients to report their experience in a structured way and give clinicians the hard data they need to diagnose, track progress, and make informed treatment decisions. They move the conversation from how's your pain to let's look at the complete picture of how fibromyalgia is affecting you. So let's break that first tool down. The Widespread Pain Index and Symptom Severity Score is the modern foundation for diagnosing and tracking fibromyalgia. When you add the scores of the Widespread Pain Index and Symptom Severity Score together, you get a single number known as the Fibromyalgia Score Index or the Polysymptomatic Distress Score, or PSD, which reflects your overall symptom burden and can be used to assess changes over time. So let's look at each part. The Widespread Pain Index is elegantly simple. It's a map of your pain. Instead of just saying, I hurt all over, the Widespread Pain Index asks you to identify every specific area where you have felt pain over the last week. There are 19 areas on the checklist. These are the right and left jaw, the left and right shoulder, the left and right upper arm, the left and right lower arm, then the left and right hip and butt area, left and right upper leg, left and right lower legs, and finally the chest, abdomen, neck, upper back, and lower back. The scoring couldn't be easier. For each of the 19 areas where you've had pain in the last 7 days, you get 1 point. If the area doesn't hurt, you get 0 points for it. You just add up the points. The final WPI score will be a number between 0 and 19. Let's take an example. We'll call our patient Sarah. For months, she's been telling her doctor she has a bad shoulder and back pain. But when her new doctor gives her the WPI checklist, Sarah takes a moment to really think about the last week. In addition to her left shoulder and her right hip, she also checks her neck, her lower back, her jaw, her right and left butt and hip area, and her upper and lower legs bilaterally. For a doctor, this is invaluable. It shows the widespread nature of the pain, which is a hallmark of fibromyalgia. It also becomes a powerful tool for tracking progress. If after 3 months of treatment, Sarah's widespread pain index drops from a score of 14 to 7, that's a concrete, measurable improvement. The symptom severity scale is where the invisible symptoms of fibromyalgia are made visible and measurable. The symptom severity score ranges from 0 to 12 and is calculated in 2 parts based on the average of your symptoms over the last week. First, you rate the severity of 3 key symptoms from 0 to 3, where 0 means no problem, 1 is a slight or mild problem, 2 is a moderate problem, and 3 is a severe problem that causes daily interruption. There are 3 symptoms you rate. Fatigue. This isn't just being tired. A score of 3 represents a profound exhaustion that isn't relieved by rest and interrupts your daily life. Waking unrefreshed. This measures sleep quality. A score of 3 means you consistently wake up feeling as if you haven't slept at all. Cognitive symptoms, known as fibrofog. A score of 3 means you have serious difficulty with concentration, focus, staying on task, and mental fatigue and disruption in getting started and completing tasks. The score for these 3 are added together for a subtotal between 0 and 9. Back to Sarah. Her fatigue is constant and debilitating, so she circles 3. She never wakes up feeling rested, so that's another 3. Her fibrofog is a daily struggle at work, so she gives that a 3. Her total ends up being 9. The second part of the symptom severity score asks about other common symptoms you've had. Have you been bothered by headaches, pain or cramps in the abdomen, or depression? For each of these that are present, you add 1 more point. Sarah deals with frequent headaches and has been diagnosed with depression, so she gets 2 more points. Her symptom severity score subtotal is 8, plus her points for the second part 2 for a final symptom severity score of 10. Putting it all together, we can help diagnose the severity. Now the clinician can put the 2 scores together. The official diagnostic criteria state that a patient has fibromyalgia if their symptoms have been present for at least 3 months, and if they satisfy one of these scoring combinations. a WPI score of 7 or higher, and a symptom severity score of 5 or higher, or a widespread pain index between 4 and 6 and a symptom severity score of 9. Let's look at Sarah. Her widespread pain index was 10 and her symptom severity score was 10. She fits perfectly into the diagnosis of fibromyalgia. With this data, her doctor can confidently diagnose fibromyalgia. They can also calculate her fibromyalgia score index, or polysymptomatic distress score, which is the widespread pain index, 10, and symptom severity score of 10 for a total of 20. This score is now her baseline. At every follow-up, she can retake the survey. Maybe her widespread pain score drops to 4 and her symptom severity score drops to 6. Now her new combined score is 10. Her new fibromyalgia score index, or polysymptomatic distress score, is 10. This is objective evidence that the treatment is working, providing a clear justification for continuing or adjusting her care plan. For the first time, you might be seeing a way to truly quantify what you've been experiencing. You now have a framework and a language to take to your doctor. The most important thing you can do is be your own advocate. Find a copy of these fibromyalgia criteria online and print it out. Fill it out before your next appointment. Don't be afraid to ask your clinician, could we use the widespread pain index and symptom severity score to establish a baseline for my symptoms and track my progress? This simple act can turn your appointments into a true partnership. If the widespread pain index and symptom severity score tell us what the symptoms are and how severe they are, the Fibromyalgia Impact Questionnaire tells us the so what. It answers the crucial question, how are these symptoms actually affecting your ability to live your life? Developed in 2009, the FIQR is a 21-question survey that assesses fibromyalgia's impact over the last 7 days. It's incredibly efficient, taking less than 2 minutes to complete, and it's a gold standard for measuring patient outcomes. It looks at 3 key areas of your life. The first section has 9 questions about your ability to do specific daily tasks. You answer on a score of 0 from no difficulty, up to 10 being very difficult. You're asked to rate your difficulty over the past week with the following activities: brushing or combing your hair, walking for 20 minutes, preparing a homemade meal, vacuuming, scrubbing, or sweeping floors, lifting and carrying a bag full of groceries, climbing 1 flight of stairs, changing bed sheets, sitting in a chair for 45 minutes, and going shopping for groceries. Let's meet another patient. John. His pain is moderately controlled, so if you just ask him about it, he might say he's okay. But when he fills out the Fibromyalgia Impact Questionnaire, a different picture arises. He gives himself a 7 for vacuuming, 8 for carrying groceries, and a 6 for climbing stairs. A high score here tells his doctor that even though his pain is okay, his ability to manage his daily life is severely compromised. The next section is overall impact. This part is just 2 questions that look at the global effect of fibromyalgia on your life over the past week, again on a 0 to 10 scale. The first question is, how much of the time did you feel overwhelmed? From 0, none, to 10, all of the time. The second question is, how much did fibromyalgia prevent you from accomplishing your goals in the last 7 days? From 0, not at all, to 10, being completely. These questions capture the sense of disability and lost productivity. John might feel his pain is manageable, but he rates a 7 on being prevented from accomplishing his goals because fatigue and brain fog stopped him from finishing a project at work. He also might feel 10 out of 10 for feeling overwhelmed all of the time. The final part is 10 questions rating the severity of specific symptoms over the past week on that same 0 to 10 scale. This is where the FIQR really shines. It doesn't just ask about pain, it asks you to rate the following: your level of pain, your level of energy from 0, lots of energy, to 10 being none, your level of stiffness from none to severe, the quality of your sleep from 0, well rested, to 10 being very tired, your level of pressure, your level of memory problems from 0 being none to 10 being a lot, your level of anxiety from 0, none, to 10 being very high, your level of tenderness to touch from 0, none, to 10 being very, your level of balance problems, and your level of sensitivity to things like loud noises, bright lights, smells, and temperature. This list is so important because it validates symptoms that are often dismissed. John rates his pain a 5, but gives his memory problems an 8, his poor sleep a 7, and his balance problems a 6, and he may have a score of 10 for sensitivity to sensory stimuli. The scores from the three domains, function, overall impact, and symptoms, are added together to create a final FIQR score from 0 to 100. A higher score means a greater impact of fibromyalgia on your life. The average score for a person with fibromyalgia is about 57. John's total score came out to 65, placing him in the severe range, even though he said his pain was okay. This score is now John's functional baseline. His doctor sees the biggest issues aren't just pain, but function, memory, balance, and sensory sensitivity. Recognizing there's a sense of feeling overwhelmed and sensory issues makes me key in investigating whether John may also be neurodivergent, whether he may have ADHD or be autistic. Those are then a deeper dive, and if those are recognized and then treated appropriately, we can also look at the impact of regular exercise, looking at physical therapy to help with balancing, and also cognitive behavioral therapy to help work on coping strategies to live better. 3 months later, John completes the Fibromyalgia Impact Score. His score has now dropped down to 42. This is where the magic happens. Research has identified that a drop of 14% in the Fibromyalgia Impact Score is a clinically meaningful improvement. John's 13-point drop is objective proof that the new plan is working to give him his life back. A conclusion that we may not have been able to recognize by tracking only his pain. So how do these two tools work together? They aren't competing, they are complementary partners that provide a 360-degree view of fibromyalgia and create a powerful feedback loop. Think of it this way. The Fibromyalgia Score, the Widespread Pain Index, and the Symptom Severity Score is your diagnostic and symptom tracking dashboard. It answers what are the symptoms and where are they? It quantifies the raw ingredients of the illness, the pain locations, the fatigue severity, the intensity of the fibrofog. It's essential for getting an accurate diagnosis and for monitoring if the core symptom load is changing. Then the revised Fibromyalgia Impact Questionnaire is your real-world impact report. It answers, how are these symptoms affecting my life's journey? It measures the functional consequences of the pain and fatigue. It tells you and your doctor whether you're better able to work, care for your family, and simply function day to day. When a clinician uses both, they can make much smarter decisions. For example, a patient's widespread pain index and symptom severity scores might stay high, but their Fibromyalgia Impact Questionnaire score might improve. This could mean that while the core symptoms haven't gone away, the patient is overall improving, a huge therapeutic win. It's very common that when I'm working with somebody, often they may not initially say they've had much improvement, but when we look at interventions and the impact of their treatment, we see then an improvement in the widespread pain index, symptom severity score, and often the Fibromyalgia Impact Questionnaire. We can say, hey, you've improved. Maybe your score dropped from 70 down to 40, which is just at the lower end of the moderate range, and it can recognize, hey, I can do things better. So much of what we're used to when we're getting medical care is to go from a 80, I have severe symptoms, whether it's a urinary tract infection or a pneumonia or an appendicitis, and then we want them completely gone. But in the world of fibromyalgia, it's important to recognize that there is often partial improvement. Usually each intervention gets between 0 to 25% improvement. And so we have to use multiple treatments. And usually we're doing often 1 or 2 at most at the time, and then reassessing the impact over the next month or so. Sometimes a number of areas in pain may not change a lot, but the amount of fatigue, the sensory sensitivity, the anxiety markedly improve. Using these tools shift the dynamic from a one-way conversation to a collaborative partnership. The patient has a clear way to report their full experience, and the clinician has objective data to guide therapy. It's no longer about chasing a lower pain score, it's about pursuing a higher quality of life, a goal that can now be clearly defined and measured. It's also very helpful to track over time. For many people, there may be no change in a medication, no change in an intervention, but they may have gone through a significant stress experience in their life. Sometimes a positive stress. They may have just had a healthy child. They may have just gotten married. They may have just gotten promoted, but that change may be increasing their score. For some, it might be, hey, I was doing great when I was in my favorite time of the year, where the weather was what you ideally need to feel your best, and now you've gotten into a less optimal time of the year. Maybe your exercise and activity have gone down, and now your score has gone up. then you can recognize, oh, okay, so there is hope. There are things that I can do that can help, and I'll try to work around the suboptimal climate, to whether that's walking indoors, putting on warmer clothes, or whatever I can do to help maintain that regular exercise and find good coping strategies to help with stress. But at least recognizing that these other factors are having an impact at least gives a sense of agency, some sense of control, like, oh, this isn't just some unknown problem that I don't know why it's happened. And then as you track this over time, hopefully you'll see maybe the next winter is better because you're now on a better combination of a healthy lifestyle and appropriate medications to help support co-occurring conditions. For too long, the conversation around fibromyalgia has been limited, leaving both patients and clinicians feeling powerless. The complexity of the illness has been overshadowed by a narrow focus on pain, while the impact on function, fatigue, cognition, and well-being has been hard to measure and therefore hard to treat. But as we've seen, it doesn't have to be this way. The Widespread Pain Index, the Symptom Severity Score, and the revised Fibromyalgia Impact Questionnaire are more than just forms. They are instruments of understanding, they are tools of validation, they provide a clear, evidence-based language that allows the full story of fibromyalgia to be told and heard. While there still is no cure, fibromyalgia is a manageable condition, and understanding your own condition is the most powerful step towards getting your life back. So what is the most important thing you can do? Download and print copies of the fibromyalgia survey criteria and the FIQR. Fill them out honestly and bring them to your next doctor's appointment. Start the conversation by saying, I'd like to use these tools to help us establish a baseline and track my progress together. This is how we move forward. This is how we ensure that the full, complex reality of fibromyalgia is seen, measured, and managed. For more resources on managing fibromyalgia and other invisible illnesses and advocating for your health, be sure to subscribe to our channel. We're dedicated to bringing you credible, research-backed information to help you navigate your health journey with confidence and with hope.